I'm Dr. Ari Brown with the 411 on epidurals. And with me today I have Miranda, who is our mom-to-be who's about to deliver, and Dr. Steve Rutman, who's the Chief of Anesthesiology at Seton Medical Center in Austin, Texas. Dr. Rutman, first of all, we want you to demonstrate where and how this procedure is done, but then also if you can kind of debunk some of the myths that people have about epidurals.
No problem. I'll start at the beginning. Epidural anesthesia is a very safe and effective way to provide pain relief for women that are in labor. I have a little chart that kind of shows you where the medicine is deposited, but it uses the same principle as when you go to the dentist and get local anesthetic for dental work. We just deposit the local anesthetic near the nerves that innervate the uterus as well as the lower part of the body, so that when women have contractions and deliver the baby, they have good pain control and are able to enjoy the labor process better. As you can see, this is a little complicated, but this is a cross section, and this is the woman's back. The needle gets inserted close to where the nerve roots are in the spine, but not into the spine. And we deposit the local anesthetic so that it will affect the nerve roots and block the transmission of pain. I will show on our lovely model here exactly how the epidural will get placed. Of course, when you do have it placed yourself, the anesthesiologist will have gloves and a gown and a mask, but for demonstrations I'll just use my hands without a mask. The most important thing when getting an epidural is to be positioned correctly, and she's doing a great job here. You kind of have to have bad posture. We ask the women to kind of slump over with their shoulders slumped, as well as their back pressed out. We say either like a mad cat or like a piece of boiled shrimp. And that allows us to place the epidural needle in the correct spot very easily. What you'll feel when the anesthesiologist is placing the epidural is first we'll identify where your hips are. And we kind of will squeeze like this till we find the level of the hips. And we also will go across and find where the midline is. And the place where the epidural will be inserted is at the level of the hips between the vertebrae. And you'll feel the spinous processes. So we'll kind of go down like this till we find the indentation. This one feels like a good spot right there. So you'll feel them with their fingers pressing a little bit, and then at some point they'll use their thumb to make a little indentation. That allows us to know exactly where to go. At this point, we'll have everything ready to go. So we'll take our cleaning solution, which is just usually a betadine alcohol solution. Use a little sponge stick like this to clean off real good. Get it nice and clean. The next point will be to use local anesthetic, just like a lidocaine type medicine. We use a very small needle for this. And we would basically use the local anesthetic to numb the skin. So we'll make an injection right there. This will sting a little bit, but most women say that insertion of an epidural does not hurt any more than getting the IV started, and certainly a lot less than a contraction. So you'll feel a little burning at the skin that will numb the area. At this point, since the area is prepped and numb, we will use a larger needle. It is a larger needle, but it does not stay in. We use this larger needle to identify where the epidural space is. At this point, as we press down on it, you will feel the pressure of the needle, but it shouldn't be painful, but you'll feel a gritty sensation. That is just us going through the layers to get to the epidural space. Once we're at the epidural space, we will inject local anesthetic to get you comfortable. The local anesthetic is just put in with a syringe. It will feel a little crampy. It's hard to explain that, but that's what women say. They feel a little cramp in their back. That's it's good and bad. We don't want you to hurt, but it also lets us know it's getting placed in the right place. So the local anesthetic will be placed there. Once it's administered, what we'll do is insert a very small and a very flexible, very soft piece of plastic. Once we find the epidural space using the needle, we'll remove the inner cannula, and we take the plastic tube and slide it in. And this allows us to place the plastic tube in the epidural space at the appropriate distance. Once it's there, we remove the needle from the skin, like that, and then this is what's left under the skin, about that far, which has holes at the end that allows us to continue to give the medication throughout the rest of your labor and delivery. So once the local is administered and the plastic catheter is placed, we will just tape the rest of the catheter to your back. It'll come up over your shoulder, and we'll hook it up to a machine that will continue to give you medicine throughout the rest of the delivery. Once you've delivered your baby, we just untape the tape and it slides right out. People are always concerned about risks with epidurals, and although there are certainly some serious complications that can happen, most of the time it goes very well without any problems. It usually will not cause any more back pain than women that don't get epidurals, and we feel that it does not cause any problems to the baby, and it's very safe for the mother as well. You might notice that you felt like you've had a shot in the back. No different than if you had a shot anywhere else, but that usually resolves within a couple weeks.